Gen Xers, millennials, multi-generation. These are just some of the terms that we are going to hear in our segment.
And welcome to the Leader's Edge, where we give actionable insights to help you thrive in a new normal.
A fantastic day to all of you. This is Sassy Casas, and I am happy to be back in this episode of The Leader's Edge.
We're here again to learn because that's what we're all about. You see, we're all about learning.
We are in for a wonderful episode tonight. Welcome to Season 5, Episode 4.
And welcome to Leader's Edge Season 4, Episode 10.
Welcome to the Leader's Edge. And today, it's Season 7, Episode 8.
It's called the Leader's Edge. We are here tonight with another amazing leader.
Good day, everyone across the world. Welcome to the Leader's Edge.
Welcome to the third episode, Season 5 of the Leader's Edge. Welcome to the Leader's Edge talk show. Today, we have a face and a name familiar with all of you. He started with us 2 years ago, and of course, you know him. He's a doctor and COVID-19 expert, also occupational health guru. So we are so fortunate because Doc Noy, as we fondly call him, is so generous with sharing. He has updates because I'm telling you, on a daily basis, he keeps abreast with global as well as local trends or what's happening now. And of course, in everybody's mind, oh my gosh, I mean, what is this? Are we ever going to get out of this pandemic? So welcome to the virtual stage, my friend and everybody's COVID-19 expert favorite, Doc Noy, Renato Josef. Doc Noy, come on.
Good afternoon, everybody. Good afternoon, Miss Dinah. Thanks for having me here. And it's quite a bit of a time already since we last met. It was before election, right? How are you, by the way?
Yes, kind of. Yes, really. It's a double whammy right now for us, but of course the number one will still be existential is the pandemic. And then of course followed by the recent events now, and which has affected a lot of people. But Doc Noy, really, what is your current assessment? Are we really ever to get out of this pandemic?
Yes, and my answer is yes, provided people will come together, get their act together to cooperate and support what the government and the whole world has been doing for the past 2 years. Let me start you by taking you back 2 years ago. Imagine yourself when the outbreak, the news came out that the pandemic is now in the whole world. Imagine that horrible, disastrous news coming into our hearts, into our minds, to the extent that we cannot really move to the best we can compared with the past lives we had before the pandemic. And to make it fast forward, when the pandemic surged to its highest level, when the Delta, which is the most horrible variant, came in, people died, so many people had been sick. Their dreaded diseases became more complicated. Eventually, they died because of COVID-19. And thank God, the vaccine was discovered in the early part of 2021 and became impactful in the mid 2021, where we sensed and carefully observed that the number of deaths dramatically went down. And that was really the effect of COVID-19. But let me bring you back a little bit about that. Remember that before the vaccine was fully implemented through the whole world, people left and right, in fact, there were many syndicates who were against the rollout of the vaccine. Now, if we were not convinced of the beneficial effect of COVID, imagine The world now has a total of 6.2 million deaths worldwide. Here in the Philippines, with our 60,000 resulted in deaths. Imagine if the vaccine were not implemented. Do you think our number would not be increasing up to a half of a billion number of people dying with this horrible, disastrous, very evil effect of COVID-19 virus? See? So if only and if the people will continue to support, now we are faced with the waning effect of the primary doses of the vaccine. 6 months had passed, approaching 1 year. Imagine again, I'm afraid we'll be back to zero and again experience the effect of the pandemic all over and over again.
Yes, Doc Noy, why is it up to now there are still sectors of people who keep on saying that they would rather be hit by COVID than be injected with vaccine? I honestly don't understand.
Okay, Ms. Diana, that's an excellent input and a question that you raise. You say people have still the mindset, and I really charge this because of disinformation and misinformation campaign all over the world. The public doesn't know that much about what's happening with the advent of the vaccine. They are worried about side effects of vaccine. The World Health Organization and the CDC both still in agreement that the side effects of the vaccine, even the mortal effects of death, are far, far behind the effects of having been bitten by COVID virus. It's negligible. The side effects of vaccines had been set at just myocarditis and pericarditis, the most common ones, which are very, very small in terms of statistics compared with the number of deaths resulting from COVID-19. So again, and this is my recommendation later, which we will be discussing on the top level, the national government or even the global agency, to come up with a integrated, holistic approach of letting the public know what's really in store for them when they do not decide on having themselves vaccinated for the boosters.
So, Doc Noy, what is the latest update as far as total population of the Philippines is concerned? What percentage of people already had the vaccines and then booster, 1 or 2 boosters? But I'm sure because you keep abreast with this, what percentage of our population are, shall we say, protected right now?
Okay, we are a strong 110 million population in the Philippines. And from that number, we have 68 million Filipino people who have completed their primary doses, 68 million. And that comprised around like 65% of the population of those eligible for vaccination. That is for the primary doses completed. Now, for the first dose, the statistics will show as of 2 days ago, it's 17 million only. Imagine that, it's very, very far behind compared with the completed primary doses. So the remaining, the difference between the completed primary doses, which is 68 million, deduct 17 million from that. So the difference is the population that has not received their booster yet, right? And this is scary. What if 6 months are along the road, furthermore, the waning effect of the vaccine primary doses will have its effect already. So what will happen to us? Here we are again. The COVID-19 will start to spread among the people all over and over again.
Yes, but some countries take it to extreme. Like, for example, in China, the population is hurting because even their economy, because this total lockdown is so, compared to number of cases, it's just so absurd. It's extreme.
My personal opinion on that, is I would not really rely, especially news coming from China, although it's WHO knows about it. I feel that the China statistic is not that transparent. And we know for a fact that China as a country is an authoritative rule that one case would spell a lockdown for the whole community or even the city, I suppose, or even the country for even one case of COVID-19. And to me, I feel that that is overdoing the pandemic addressing the pandemic. You see, we are now on the COVID variant, and that's a bit of a good news because from the Delta, comparing it with the Delta, COVID variant is very much less severe, very, very less severe. In fact, to give you an example here in the country, only 10%, despite the number of cases, the statistics dictate upon us that there is only a 5 to 10% increase of the cases, and 10% go hospitalized. This is PGH data. And it's good to know that most of the cases at PGH are of moderate degree only. Very, very less severe COVID-19. All right, but we do not know until when will it continue to be less severe, because we know that as a matter of survival, the COVID virus has its innate property to be converted into a more potent one. We just don't know about that. There's even a study that it could escape the effect of the vaccine later on. So as of now, Ms. Dinah, this is the point here. We must cooperate. Each and every Filipino or each and every person in the whole world must cooperate to take hold of the efficacy of the current vaccines against the COVID variants. Current studies still show that the current vaccines are still efficacious against the COVID variant. What if, all right, what if the people will remain unvaccinated and unvaccinated people will let the mutation take place further, and that may result in more severe or potent variants?
Oh,
See, this information most people do not know.
Yeah. So meaning to say, the more people will refuse to be vaccinated, the more chances of it becoming even worse.
Definitely, because one property of this COVID variant, the Omicron, the thing is, it's very infective, right? It easily infects one person to the other, correct? It's very transmissible. So in the process of transmissibility, what happens is the form of this current COVID variant, there is a possibility to mutate to another form. All right, and the longer it stays in the body of the patient, the higher is the chance for it to mutate to a different form.
Oh my goodness, I'm reminded of something because many of my friends and relatives now are hesitant to have a second booster. We all had vaccines and then we all had first booster. Now they don't want second booster because they said they heard that several of their friends got really, really sick. Some of them died and all. And so, which is actually, I'm on the verge of deciding whether I myself should get a second booster.
The current issue that we are confronted on in this whole world is the issue of this pandemic is not an individual health concern. This is a public health concern. So as the adage of the World Health Organization says, no one is safe until everybody is safe. You see, Ms. Dinah, I keep on repeating this, and I remember 2 years ago when we started a series of these COVID sessions, I really leave it upon God. God is the ultimate decision maker of how he would be able to control, or the pandemic will be controlled all over the world. You see, we cannot just be successful in our information campaign to people, because the mindsets of people, we're talking of different values, different beliefs, and this is a really scary that people will not be convinced of the beneficial effects of having the booster doses. So prayer is the answer at this point in time.
And you know, Doc Noy, we are in the midst of two great stressors in our lives right now, because in spite of this goings on with the pandemics, and then we have this what we call hotly contested and
Mhm.
highly dramatic, highly emotional election. And I have so many friends, relatives, practically people I know, neighbors, who just cannot accept the results because it's not what they thought, that what they expected, you know. So they are all what we call really glum and depressed and hardly wants to talk, and they keep to themselves, and the whole family, I'm telling you, even the children are affected. So it comes at a time when we are still fighting this pandemic, and here comes a second stressor. So what will that do to the mental, psychological, emotional makeup of our people?
Perfect question. Item that you've raised this, Diana. This is actually what concerns me for the past 2 weeks post-election results, because for me, I felt that there might be an issue in terms of the support of the LGU health centers or even the national government when our preparedness for COVID is not yet in place. So that is really my concern. So how I wish with the sitting of the new president, it would be his priority, even up to this time. It's really on my thought that he must prioritize this. He must not wait until this pandemic surges again to its highest level in the country. So that it brings to my mind to our discussion now the situation of each and every Filipino. People who felt that they lost because of cheating in the election. My fear is we will not be having their support in terms of complying with the vaccine as a form of silent protest to the government, not knowing that they are not hurting themselves or their families alone, but in fact, it is impactful for the whole community and for the whole country, and for the whole world for that matter. You see, and therefore, I thought of, if ever, I think I just crossed my mind that with my weekly conference with the UP Stamp COVID Death Conference every Friday, I could raise this issue. That's really, it's high time that the LGU health centers, the support of the local government is very effective. It's very impactful in terms of persuading the people to get vaccinated because of the reasons that I've stated before. All right, no one is safe until everybody is safe, and the effect of the primary doses of the vaccine is waning. And if we don't act on it, we are afraid that the pandemic surges again to the highest level, back to zero, where we were 2 years ago.
Yeah. Well, this is the reason, Doc Noy, that honestly, you have become our favorite speaker because it is something that is not fleeting. It's ongoing. So we constantly need updates and good counsel, because at the same time, there are other groups of people giving us different versions, different opinions. So we need to hear from a true expert.
That's in fact, that's indeed true, Miss Diana. And there are lots of good news actually happening in the whole world. In fact, as we speak in this session, there is an ongoing global conference sponsored by international agencies, in which so many countries of the world are there in attendance to talk about the global approach for the pandemic. Here we are now in the different episode of the pandemic. This is not the same situation we were confronted 2 years ago, because we already are feeling the effect of the vaccines, right? So it's a different scenario. It's a different strategy this time. But the thing is, the whole world should have a harmonized program. Whatever is agreed upon by the experts based on the very in-depth study of the COVID-19, everybody should agree. Every government of all nations should agree on a harmonized implementation strategy. All right? Because mind you, these are all experts. They know to the minutest detail of how the virus behave. And thank God that we are now in the second year, and the researchers, the scientists, know the full details of the properties of the COVID virus, not like 2 years ago, where the people are blinded, where the experts just treat patients. They do not know really how to treat the COVID patients effectively.
So, Doc Noy, am I correct? Because the information that I have received so far is that the countries that cannot afford the vaccines, they get donations from the more developed countries. They get donations of vaccines. Is that correct?
That is correct. That is correct. In fact, one of the very generous countries, for all we know, is America, of course, and the European countries, primarily the Great Britain. On top of that, even before the start of the worldwide vaccination campaign, WHO itself has a donation part of their office, which gives free vaccines to poorest countries. So I have stated like a 60%, 70% completion of rich countries all over the world in terms of the primary doses. Sad to say, on the other extreme, the poor countries only could hardly reach the 10% target of their population vaccinated. As of now, even they could not get to reach that high a percentage. The major reasons are two actually. One, it's cultural. People who are far flung from the city, they still are not educated of how the vaccine would work. That's number one. Number two is most of these countries are very, very far, very inaccessible to transportation. See, so it takes like kilometers and kilometers of travel through a rugged road to the mountainous areas for these people to be vaccinated. So these are the two primary reasons why their population is still not that high vaccination rate.
So if you were to become, all right, like part of a panel of advisors to the new administration, what would be your plan or suggested for the new administration to help the people who have become quite depressed, not only with the pandemic but also with this latest really hotly contested results of the election? So what would be a way by which everyone will be able to what we call get relief from all this negative impact of these two big stressors?
You know, I'm so glad that we had this session, Ms. Diana. Just crossed my mind up to this minute. You know what I'm going to do? Tomorrow is today's Thursday, right? Tomorrow would be our Friday conference on COVID-19 with the UPPGH people. This is a weekly conference, and I will really raise this up to address the situation post-election with a strong psychosocial support system in the community. So I would like to impart or share in my little way the effect of psychological first aid among these people who were claimed to be cheated of election. Because as I've stated earlier, my fear is they would not cooperate with the vaccination campaign of the government as a form of silent protest until their psychological emotional makeup will not be resolved with a psychological approach. You see, the situation is, it's not that we are accepting what's happening, but the way to go is to move forward. All right, we can let the impact of the election affect us, but we should not allow our emotions control our future plans. And because the losing end, we will be the losers. We will be the losers, and it will be impactful not only for the Philippines but for the whole world. See, I will be strongly working with actively with the UP people there who are in charge of this COVID campaign. And one thing that I would like to also share with is my opinion on disinformation, which I am happy to share with you that based on my researches, there has been a intensive global campaign headed by the World Health Organization to address the disinformation. Okay? And they started in 2020. That was when the COVID vaccination was about to be implemented. And of course, it takes time for this information agency. There is a there is an NGO which has been established in the US, all right, in charge of addressing this information. And they say it's part of their mission not to accept donations from private companies, particularly pharmaceutical companies, because sad to say, it could be also that I'm not saying that there is a hanky-panky happening there, but it could be possible because the pharmaceutical companies who have discovered vaccines could use this strategy to, say that, oh, come on, that is make you be afraid of the COVID-19 for the vaccines to be veiled off. You see? So I praise this NGO who has this wise idea to come up with such a agency. It's an NGO. It's just started 2 years ago, and I wish to join the team all the more because of their mission and vision. This information, because of the social media, is really our one of our enemies at this current time. This information, not only of the vaccine, and this information which we were victimized upon by, the winning president, sad to say, because of the massive disinformation campaign.
So, wow, you have a lot of work ahead of you, Doc Noy.
So happy.
Yes. I guess you have found a divine purpose, of being where you are and what you know. And I am just so amazed, very impressed with your continued commitment, because I know you're not doing this for a fee. This is public service, really. So not a lot of people will do that. So your heart is in the right place. I praise God for you.
Hallelujah.
Yes, indeed. So these are things that will take time. You cannot just wave a magic wand and say, oh, all of you, you better start doing this. So it needs also the right, what we call the right mindset and the right kind of leadership to let people follow what is the best way to do. The best way to do. So I really hope that this will come about, that after some time, people will start accepting this. Both of this, actually, because, well, the pandemic is a different thing, because really it's been going on for so long, and somehow vaccinations, booster shots have been done, but not quite enough, as you have just mentioned. And so I hope that the election, what we call negative impact of the election, will not last for too long, because it's going to affect the people even more drastically.
Yes.
I really hope so.
Agree.
Yes. So Doc Noy, we still have some minutes ahead of us. So what for you would be, just quickly, what for you can you give our viewers some coping mechanisms that we can, the general public can have to somehow alleviate what we are feeling right now?
Okay, let me respond to your question in twofold. First, let me focus the discussion of us as leaders of our own respective organizations or communities, because it's very important for those who are affected with the election results or even the pandemic, in whom the people are suffering from financial hard up, psychological difficulties, emotional problems at left and right, etc. It's very important for us leaders to listen to these people who are victimized by the issues that are confronted because of this election and the pandemic. So it's very important for us that we leaders should listen to their issues, hear them out, hear them out. And let us also bear in mind that, as we know, there are stages of this grief, wherein we must size up where the level of our listener is at, because there are levels in the acceptance phase where people could not simply accept what had happened. All they want is just for them to be listened to, correct? They are not receptive to any advice at a certain stage of that difficulty. Until such time, because of their coping mechanism and with our proper approach, psychological approach in talking with them, they will arrive at the acceptance level. In fact, before the acceptance level, it's perfectly to hear them, like if your friend, for example, comes to you, Ms. Diane, and say, can you please leave me alone with this issue? Because for all we know, he or she is undergoing the stage of anger, and that is perfectly psychologically perfect. So if you are not knowledgeable enough to handle that, and if you come up with a bad or a erroneous psychological approach, and you keep on scolding that person, I'm afraid it would have a disastrous effect psychologically. See? So that we have to wait for the level at which he would or she would be receptive to our advice, from the bargaining stage up to the level of acceptance, wherein that person now would be ready to accept our advice. So this is just part of, what we call the psychological first aid, which is very important. Now, for individual person, the second half of that is the person who is affected. It's very important that people who are affected, or a person who is affected, comes near to a person whom he trusts or he trusts so much, and then raise his concern about the election results or the pandemic issues, etc., etc. And then, of course, be reminded that the person also still needs maintenance of his physical health, the right exercise, the food that he is taking, because the food that is being which he or she is taking has some effect on the stressful events of his individual self. So, of course, one way of checking it up is, no matter how stressful we are as a person, we should always keep our social environment intact. Meaning, we have to make sure that we are psychologically in touch with our friends, with people who are near with us emotionally, people who are there to share our issues in life. And this is very important. Now, as an overall picture, the government, the LGU, should have a full training of their medical personnel on this regard. They have to have a focus on psychological consultation, counseling, less on the physical aspect of health, because psychological support is what the people need now at this very point in time for us to survive this pandemic.
Doc Noy, I know a lot of people who are planning to travel because they could not travel the past 2 years. So what are the aspects of travel? Meaning, what are the safety hazards with traveling? I mean, how do we mitigate these safety hazards when it comes to travel?
Okay, when we talk of the pandemic effect, is COVID-19, we just have to ensure that we are fully vaccinated as per schedule. All right, the right interval doses of the vaccine has been received by us, by its individual traveler, and of course, observance of the public measures, the basic ones, the wearing of masks, safe distancing, open ventilation, a good ventilation wherever we are. All right, so with that, that is safe enough to travel. All right, and then let us bear in mind, and in case the virus is very, very aggressive and hits us, what do we get? What do we get is a inherent capacity to recover from the Omicron variant, which is a good news, incidentally less severe. And in fact, from recovering of the COVID variant, of this Omicron variant, what we get would be an enhanced natural immunity because of natural infection. Is they provided two things: your vaccination is received as per schedule, and number two, in case there are comorbidities, the core morbidities are properly controlled, so that
Oh,
it would be a safe travel already. So Miss Dinah,
oh.
you can travel.
Yeah, because I'm planning to visit my daughter in
See,
the
I
US.
I
Yeah,
knew it.
and my best friend. Okay, sometime late July, and I'll be back early September. Because
Oh,
yes,
you are
because
US?
US, yeah. LA, that's where my best friend is, and then she's coming with me. We go by plane to see my daughter in Indiana,
Uh-huh.
Bloomington, Indiana. So uh, it's very soon. That's the reason why I thought it best to ask you, being the expert, how safe is it now to travel?
So
Yes,
I think I made myself clear on that.
yes. So
Vaccination and then comorbidity controlled.
yes. So it means, therefore, I might as well get my second booster.
No, but the government is not yet open for the second booster. All right, you had your first booster already.
Yeah, yeah.
You had,
And
you had
they,
it.
they they already invited us here, at least in our area, for the second booster.
That is an
Yeah.
advance privilege for you to
Oh, in
receive the
fact,
second. Okay.
what they have said is, because initially I could not go there during their schedule, but they said, no, you can come in now. I mean, it's like, you just come in, because if you show us your record, your vaccine
Uh,
cards, etc.,
uh,
then you're in.
okay, because the eligibility talks about senior age and the presence
Seniors.
of
Yeah,
comorbidity.
yeah.
Therefore you're
Yes.
eligible to receive the
Right,
vaccine.
right.
Okay.
So I can go
Oh
like
yes. No.
yeah, from every day. Every day you can go there.
Yeah.
From
In fact, the good news now is the LGU clinics, the health centers, do not
yes,
have do not require registration anymore. It's just a
yeah.
walk-in, not like the
Right,
previous
right.
doses that you have to register online or go to the health
Yes,
center for pre-registration. Now it's
right,
walk-in concept. Everybody could have the vaccine through walk-in.
right. Well, I want to give you this opportunity, Doc Noy, to give wise counsel to our viewers, and many of our viewers are really so looking forward to hearing from you again. And because everybody thought, honestly, Doc Noy, I'm one of those who really thought, so it's ending. Oh my goodness. And so it looks like it's not really, and it's not yet, it's not yet ending. So Doc Noy, I know that this will affect many people for many more months to come. So please give us your wise counsel, and how do we cope up with this? Doc Noy, please.
All right. Thank you, Ms. Dinah, for having me here again in your show. And I would like this opportunity to take this as parting words as a key takeaway messages. It's very important to understand that this current pandemic is not a individual health issue anymore, but rather it's a public health concern. So the public health strategy must be in place for its LGU to implement its own programs and activities that is for the government. And for the workplace, you know for a fact that I'm specializing in occupational health, there must be a intensive campaign from the level of people of the cabinet of the incoming president, the Department of Labor, to enforce the immunization. What I mean enforce is to strongly encourage, not to force the workers, but to encourage. Let them understand. Let them have the advocacy understood the importance of receiving or completing the doses of the vaccine. Because as would I repeat it again, I may borrow the words of WHO, no one will be safe until everybody is safe. And we are saving the world with God's grace. We need divine intervention for each one of us to cooperate to make this pandemic end a reality.
Wow, yes. So there you are, ladies and gentlemen. We have heard from our favorite COVID-19 expert and occupational health guru. And indeed, it's best to follow the scientific findings and really the proven way to Well, it's for our own good anyway. Yes, indeed. And thank you once more, Doc Noy. That really helps a lot. And you have just, well, you have actually shot two birds with one stone, because there's not one but two stressors now, really, indeed. So, so ladies and gentlemen, remember that learning is a never-ending journey with limitless vistas. And watch out, because Doc Noy now is our speaker, episode 11 and season 8. Our episode 12 is Michelle Cordero Garcia, who will talk about People First re-entry program, and that is more of for the welfare of people in the workplace. So watch out for this. And thank you so much. And by the way, Doc Noy, how will people who want to be in touch with you? But I believe we can also take care of that, because we do plan to offer you your, what we call the mental wellness program that you have to actually to as many people as possible for our next program.
Yes, they could get in touch with you, with the Bureau directly through your website, or through me personally through my email. And may I mention that Renato.Josef, Josef, at yahoo.com.ph. So I'll be more than willing to accept such invitation. Of course, a free community service in the name of glorious God, in the service of our Lord Jesus Christ.
We're fortunate to have you with us, Doc Noy, and God bless you. Thank you so much for your time and effort. Thank you, and for your expertise. It's so treasured. It's really valuable, really. Thank you.
To God be the glory. Bye-bye.
Bye.